know, these next 3 medications have been all over the NCLEX, so I'm gonna break it down for you and tell you exactly what you need to know. No more, no less, no fluff. Like, save, share this out, comment down below if you find this helpful, and let's go. First medication is methylphenidate, also known as Ritalin. This drug is a CNS stimulant which helps to increase the dopamine and the norepinephrine in the brain, which improves focus for someone with ADHD. I want you to think it wakes up the brain, but it slows down the growth. For your NCLEX, you must know you need to assess your height and weight, especially with children that are on this medication. It can suppress appetite and stunt growth in kids. Give it in the morning after breakfast, so to make sure that they're eating and they're not up all night. Side effects are insomnia, tachycardia, and anxiety. Also want to have somebody that is on this medication not to ingest caffeine. Have to monitor for signs of abuse. This is a controlled substance. Next tip, if a child is not gaining weight, the priority is to notify the provider. They may need their dose adjusted or a drug holiday. Second medication is Lamotrigine, also known as Lamictal. The anticonvulsant that is a mood stabilizer, blocking sodium channels and decreasing glutamate. This is used for bipolar and epilepsy. Big NCLEX alert with this medication is watch for Stevens-Johnson syndrome. This is a life-threatening rash. Think of Stevens-Johnson has a rash. If the patient reports a new rash, stop the med and notify the provider immediately. Don't confuse a mild rash versus a systemic sign, which is fever, mucosal lesions, because that is an emergency. And a patient that's on this medication, you need to monitor for suicidal thoughts and CNS depression. NCLEX little trick is, the question mentions a new rash or flu-like symptoms. Correct action, discontinue, and call the healthcare provider. Don't just monitor. Third medication is Allopurinol, also known as Xyloprim. This medication is used to lower uric acid production in the body because it inhibits xanthine oxidase, which prevents gout attacks and kidney stone. But this medication is not for acute flare-ups. Make sure you remember that. What you need to know with this medication is you need to take this with food to avoid any GI upset. You need to encourage fluids 2 to 3 liters per day to prevent kidney stones. You need to avoid purine-rich foods. Examples are organ meats, alcohol, shellfish. Another medication, you need to watch for Stevens-Johnson syndrome. Monitor for a rash. Report that rash immediately to the provider. Monitor their labs, especially their renal function, BUN and the creatinine, and your uric acid levels. The NCLEX tip for this is Allopurinol, all uric acid down. Never start this during an acute attack, for prevention and not treatment. I guarantee you they will make some kind of critical thinking question on the NCLEX with that. It'd be a patient teaching or talk back, not for acute gout attacks. This is for prevention, not treatment. Let's wrap it up real quick. Methylphenidate equal focus but stunts growth. Lamotrigine, a mood stabilizer plus rash alert. Allopurinol for gout prevention, not cure. Understand these medications, it's going to help you so much on passing your NCLEX. If you want more information just like this, grab my study notes, they're at the top of my page. People are loving them and having major success with them on their NCLEX. I hope this helps. Like, save, share this out, help somebody else, and happy studying.